Hello students, we have already discussed about the viral diseases and today we are going to study about bacterial diseases. So today's our topic is bacterial diseases. Okay, bacterial diseases means diseases which are caused by bacteria. Okay, bacteria are single celled organisms which are generally very small in size and they are comparatively in our body they are very small in size. They can reproduce themselves when they enter in the body. Okay, so if we talk about bacteria, then bacteria are single cell organisms. Okay, and they are very small in size. Now bacteria are of two types. One are very harmful and one are very useful to us. Okay, now in this chapter we will discuss about the harmful bacteria. Harmful bacteria means bacteria which can harm our body, which can cause diseases. So generally on the basis of bacteria, harmful bacteria and what diseases they cause, we will study about three common bacterial diseases. They are diarrhea, typhoid and tuberculosis. Okay, so we are going to discuss three common bacterial diseases: diarrhea, typhoid and tuberculosis. Okay, now let's talk about diarrhea. First of all, we will discuss about diarrhea. Diarrhea. Diarrhea means frequent discharge of water feces from the body. Diarrhea means frequent discharge of watery feces from the body. Okay. Generally, it is an intestinal disease or intestinal infection. It's an intestinal infection. Okay. And it is caused by Staphylococcus bacteria and E. coli bacteria. Caused by Staphylococcus and E. coli bacteria. Okay. Now, one more thing is when the bacteria enters in the intestine. Okay, look here. When the bacteria enters in the intestine, then here it damages epidermal and then it enters, it secretes potassium rich ions. Then what happens when it enters the potassium rich iron in the cell? Then there the concentration of potassium ion increases comparatively outside, means concentration of potassium ion is less than the comparison of the inside. Then what happens, these potassium ions with the water moves outside the cell, means they move from higher concentration to the lower concentration. It takes water with it, so diarrhea occurs in this way. Okay, then what are the symptoms? If we talk about symptoms, then stomach pain, stomach ache, cramps in stomach, vomiting, fever. Okay, now if we talk about the control of this disease or treatment of disease, then first of all person should take water in rich amount, means he should take water. Okay, then he should take antibiotics. Even when he takes water, he can add some salt and sugar in it. Water plus salt and sugar. Okay, antibiotics. Antibiotics, and even the patient should be given isabgol with curd. Isabgol with curd should be given to patient. And ORS should be given in regular intervals. ORS should be given to patient at regular intervals. Okay. So let's talk about diarrhea. Diarrhea means diarrhea is frequent discharge of watery feces from the body, and if the water is passing from the body continuously, means there will be lacking of water. So water person or patient should have water in regular intervals. Okay, then it is caused by the Staphylococcus and E. coli. Symptoms: stomach ache, cramps, vomiting, and then treatment. What kind of treatment we should given to the patient? Treatment means water plus salt and sugar solution can be given to the patient. He should be given antibiotics. Isabgol with curd should be given to the patient to get relief, and even ORS solution can be given to the patient at the regular intervals. Okay, now let's talk about the preservative measures. Next is preservative measures. Then in the preservative measures, important point is personal and community hygiene, means we should keep ourselves clean and our surroundings clean. Proper personal and community hygiene. Okay, then person should take proper and disinfectant water or boiled water. Should take disinfectant or boiled water to avoid disease. Okay, and use of only disposable, use of boiled water and use of disposable vaccines and whatever things they use. Proper use of disposable things. Okay, So this was all about diarrhea. Now we will study about typhoid. Now next we will discuss about typhoid. That's also a bacterial disease. Next is typhoid. Generally it is caused by bacteria Salmonella typhi. It is caused by bacteria Salmonella typhi. Okay. It is generally found in the intestine of a man, and generally it affects the children of age group of 1 to 15 years. Okay. If we talk about its position, then it's found in intestine of a man. Means it affects the intestine of a man. Now, how does it transmit? It means mode of transmission. Mode of transmission of typhoid. Generally, it is transmitted by taking food and water which is contaminated with the feces. Okay, and what happens when a fly sits on the feces and then it takes the pathogens from it, and then when it sits on the food, then it releases pathogens on that food, and once we take that food and water, then we get infected. Okay, so mode of transmission, if we talk about, when we take that food, that contaminated food and water, then it enters in our mouth, and from mouth it goes to the intestine, then there it multiplies in the lymphoid tissues, and then finally it is excreted with the feces. So mode of transmission, the mode of transmission is mouth, means it enters via mouth. Okay, then it goes to the intestine, and in the intestine it multiplies there in the lymphoid tissue, multiply in lymphoid tissues. Okay, and then finally it is excreted with feces. Okay, so mode of transmission of this bacteria Salmonella typhi is when a housefly sits on the feces, it carries pathogens with it, and when it sits on the food and then we take that contaminated food, then with the mouth, means via mouth, it enters in our intestine, and there the pathogen, means that organism multiplies in lymphoid tissues, and then finally it is excreted with the feces from outside the body. Next is symptoms. What are the symptoms? Generally headache and continuous high fever in first and second week, then later on in third and fourth week it decreases. Symptoms. What are symptoms? Then symptom is high fever, okay, headache in starting first and second week, first and second week, then it decreases in third and fourth week. Next is abdominal pain, constipation. Next symptom is abdominal pain, okay, constipation, and inflammation in liver and colon, inflammation in liver and colon, means it get swollen. Another is extreme weakness, extreme weakness, and sometimes rose colored rashes can be appeared on chest or on the stomach or abdomen. Sometimes or in some cases rose like or rose colored rashes on the chest, okay, or abdomen. Okay, so these are the symptoms by which we can identify that person is suffering from typhoid. Okay, once you take the patient to the doctor, then what kind of treatment is given? Generally, the patient is given with antibiotics. If we talk about treatment, then treatment is antibiotics. Okay, a regular dose of antibiotics will be given to the patient to recover. And if we talk about preventive measures, then personal hygiene and community hygiene is the main measure of prevention. Personal or community hygiene, okay, then we should always take covered food and we should take disinfectant or boiled water. Covered food and disinfected water, or we can say boiled water. Another thing is that proper underground sewage should be there to dispose the excreta of the patient. Proper underground sewage to dispose excretions okay. So these are the preservative measures. How can you cure yourself? There is a treatment, and how can you prevent yourself from the disease of typhoid? Now next we will study about the tuberculosis TB. Now next we will discuss about next bacterial disease, that is tuberculosis or TB. If we talk about tuberculosis, means TB, generally known as TB, then it's a severe disease. Generally 500,000 people die with this disease. Now you can understand how severe it is. Tuberculosis, also known as TB. Okay. If we talk about causing agent, then it is caused by Mycobacterium tuberculosis. It is caused by Mycobacterium tuberculosis. Okay, you can say this is an infectious disease. How it is infectious disease? Because it spreads from one infected person to another. Okay, if we talk about mode of transmission, how does it transmit? Mode of transmission. Then mode of transmission of TB is air. How it happens? Like once an infected person exhaled or coughs in the surroundings, then it exhaled water, this organism or this microbacterium with the water droplets, and then these water droplets moves in the atmosphere until they get the another host. Once they get another host, means once the other healthy person inhale these water droplets with the air, then it reaches to the lungs and then it infects the lung. So tuberculosis, thus we can say that tuberculosis is caused by Mycobacterium tuberculosis, and it affects the lung, or we can say it infects lungs. Okay. So mode of transmission is when a person coughs, it exhale water droplets and when these water droplets are inhaled with air by a healthy person, then it reaches to the what reaches? This bacterium reaches to the lungs and infects the lung Okay. Which person? Infected person. Okay. So mode of transmission is this. One another way is when a person takes contaminated milk containing bovine TB. If a man takes contaminated milk having bovine TB. Okay. Then also the person will get infected with TB. Now next is, what are the symptoms? If we talk about the symptoms, then what are the symptoms of TB? Means continuous coughing, fever, okay. This is the main sign, that cough and fever. Okay. Next, if we talk about As it is the infection of lungs, then maybe swelling in the lungs, So these are the main symptoms of tuberculosis, means person can suffer from fever and continuous cough, and it may have some swelling in the lungs. Now we will talk about the treatment. If we talk about the treatment, then person should given BCG vaccine. Okay. Next is preventive measures. What are the preventive measures for tuberculosis? First of all, isolation of TB patient, means TB patient should be isolated. He should be kept in separate environment. Isolation of TB patient. Okay. Next, good nourishment and sanitary community. Good nourishment and sanitary community. Good nourishment means a person should have healthy, proper, nutritious diet, which should have a balanced diet, means which should contain all the nutrients so that it can increase the immunity of our body. Sanitary community means our surroundings should be proper, clean, proper, hygienic. Next, immunization with BCG vaccine. Immunization with BCG vaccine. Okay, by giving BCG vaccine, we can increase the immunity. Next, eradication of TD from cattle. Eradication of TB from cattle. Okay, so by following these preventive measures, we can cure the tuberculosis. Okay, next we will talk about disease caused by protozoa. Now next we will discuss about protozoan disease. Till now we have discussed viral disease, bacterial disease. Now we will discuss about protozoan disease, which is caused by protozoa. Next is protozoan disease. If we talk about protozoan disease, means disease which is caused by protozoa. In this topic, we will discuss about disease malaria. It's a severe disease. Malaria is a severe disease. Generally, it is found in the Africa and Asia, and generally more than 300 people get infected by malaria. If we talk about causes, then it is caused by malarial parasite Plasmodium. It is caused by malarial parasite Plasmodium. Clear? It is caused by malarial parasite Plasmodium. If we talk about mode of transmission, how does it transmitted, means how does this parasite transmitted in the body, then mode of transmission is mode of transmission. Okay, so this malarial disease means malaria is caused by malarial parasite Plasmodium and it enters in the body through the mosquito bite. So, we can say that malaria is caused by mosquito. Mode of transmission, what happens when a mosquito bite an infected person, then it sucks these Plasmodium parasites from the blood. Okay, and then when it sucks the blood, it sucks the Plasmodium parasite with the blood, and then this parasite moves in the salivary gland, means saliva, and then when it bites another person, means that is the healthy person. When this mosquito bites another healthy person, then it releases its saliva there, means it releases parasite with the saliva there before sucking the blood, and then this another person get infected. Okay, so mode of transmission, generally what happens when female mosquito Anopheles, okay, bites an infected person, then it sucks these parasites. Which parasite? Plasmodium. Then it sucks parasites with the blood. Okay. Then this parasite migrates in the salivary gland, or we can say that this parasite migrate in the saliva. Then parasite migrates in the saliva of that mosquito. Okay, and when this mosquito bites a healthy person, then it releases its saliva in the blood. Which saliva? Which is carrying these parasites, then it releases its saliva in the blood before sucking it. Means before sucking the blood. Thus the person get infected. Okay. Clear? So mode of transmission was that when female mosquito bites healthy person, it takes parasites from that, and then when it's bite to healthy person, it releases parasite in the blood before sucking it, and then person becomes infected. Now what are the symptoms? If we talk about symptoms, then symptoms are headache, muscles pain, fever. Okay, so main symptoms of malaria are headache, muscles pain, fever, etc. Okay, now what are the preventing measures? Let's discuss about the preventing measures. means doors and windows should be wire gauged. If we talk about preventing measures, then doors and windows should be wire gauged, wire gauging of doors and windows, so that it will not let the mosquito in. Periodic spray of disinfectant, periodic spray of disinfectant, or we can say periodic spray of insecticides like DDT, okay, and even we can spray kerosene in the ponds so that they can kill larvae. Spray of kerosene in ponds to kill larvae. Okay, sorry. Spray of kerosene in ponds to kill larvae. Okay, so by following these methods, we can prevent disease. Clear? Thank you.